Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the prevention and anesthesia and surgical care, ASC.
How the patient and family involve in anesthesia plan of care.
Patients and their families are actively involved in the anesthesia plan of care through these key steps. 1. Pre-Anesthesia Discussion. The anesthesiologist explains the planned anesthesia type, procedure, potential risks, benefits, and alternatives in simple terms. 2. Consent process. The patient, or legal guardian, provides informed consent after all questions are addressed and they understand the plan. 3. Consideration of patient preferences. The care team takes into account the patient's medical history, cultural preferences, and any specific concerns. 4. Family input. Families are encouraged to share relevant information about the patient, such as past reactions to anesthesia or any underlying conditions. This collaborative approach ensures that patients and families are fully informed, their concerns are addressed, and they are partners in the care process.
Who is the responsible to give anesthesia to high-risk, pediatric and major operation?
For high-risk, pediatric, and major surgeries, the responsibility of administering anesthesia lies with a qualified anesthesiologist or an equivalent highly trained professional. Key points include: 1. Anesthesiologist's role. A board-certified anesthesiologist with experience in handling complex cases ensures the highest level of safety for these patients. 2. Specialized training. Pediatric anesthesia requires specialized training to address the unique needs of children. High-risk patients may involve a multidisciplinary team led by the anesthesiologist. 3. Accountability. The anesthesiologist ensures comprehensive pre-anesthesia assessments, selects the appropriate anesthesia type, and monitors the patient throughout the procedure. This ensures optimal care and patient safety in complex or high-stakes surgical situations.
Tell me, when would an informed consent required?
Informed consent is required in the following situations. 1. Before surgery or invasive procedures. For any surgical or invasive intervention, including biopsies, endoscopies, or catheter placements. 2. Before anesthesia administration. Consent is needed for general, regional, or local anesthesia, with a clear explanation of risks and benefits. 3. Before high-risk treatments. For procedures or treatments with significant risks, such as chemotherapy, radiation therapy, or blood transfusions. 4. In research or experimental treatments. If the patient is participating in clinical trials or undergoing experimental procedures. 5. When required by law or policy. As dictated by local regulations or institutional policies. Informed consent ensures the patient understands the procedure, risks, alternatives, and potential outcomes, empowering them to make an informed decision.
Tell me, how do you ensure the safety of the patient during procedural or conscious sedation?
To ensure patient safety during procedural or conscious sedation, the following measures are taken. 1. Pre-Sedation Assessment. Conduct a thorough evaluation of the patient's medical history, allergies, and current medications. Obtain informed consent and explain the procedure, risks, and benefits. 2. Monitoring during sedation. Continuously monitor vital signs, including heart rate, blood pressure, oxygen saturation, respiratory rate, and level of consciousness. Use appropriate sedation scales to assess and maintain the desired sedation level. 3. Qualified personnel. Ensure that a trained healthcare professional is present to administer sedation and another to monitor the patient throughout the procedure. 4. Emergency preparedness. Keep resuscitation equipment and emergency medications readily available. The team should be trained in advanced life support. 5. Post-sedation care. Monitor the patient until they recover full consciousness and meet discharge criteria, such as stable vitals and adequate respiratory function. These steps prioritize patient safety and minimize risks during procedural sedation.
Tell me, what is procedural sedation?
Procedural sedation, also known as conscious sedation, is a medical technique used to reduce pain and anxiety during minor surgical or diagnostic procedures while allowing the patient to remain awake and responsive. 1. Medications used. Sedatives and/or analgesics, e.g., midazolam, fentanyl, are administered to relax the patient and minimize discomfort. 2. Patient state. The patient remains conscious, able to follow instructions, and maintain their own airway. 3. Purpose. Used for procedures like endoscopies, dental surgeries, or setting fractures to enhance patient comfort and cooperation. 4. Safety measures. Continuous monitoring of vital signs and oxygen levels to ensure patient safety. Procedural sedation ensures patient comfort while maintaining a rapid recovery time compared to general anesthesia.
Is your doctor privileged to administer conscious sedation?
Yes, but only doctors who meet specific qualifications and institutional requirements are privileged to administer conscious sedation. Here's how this is ensured. 1. Credentialing and privileging. Doctors must undergo a formal credentialing process that verifies their training and competence in administering conscious sedation. 2. Training and certification. They must complete training in sedation techniques, patient monitoring, and emergency management. Certification in advanced life support, e.g., ACLS or PALS, for pediatric patients, is typically required. 3. Institutional policies. The healthcare facility grants privileges based on adherence to its policies and procedures for conscious sedation. 4. Competency assessments. Regular evaluations are conducted to ensure ongoing competency in sedation administration and patient safety practices. This process ensures that only qualified and trained professionals are authorized to perform conscious sedation, prioritizing patient safety.
How do you ensure the safety of the patient just received conscious sedation?
To ensure patient safety after conscious sedation, the following steps are taken. 1. Continuous monitoring. Monitor vital signs, including heart rate, respiratory rate, blood pressure, oxygen saturation, and level of consciousness, until the patient fully recovers. 2. Airway management. Ensure the patient maintains an open airway and normal breathing without assistance. 3. Reassessment of alertness. Regularly assess the patient's level of consciousness to ensure they are awake, oriented, and responsive. 4. Post-sedation criteria. Confirm that the patient meets discharge criteria. Stable vital signs. Ability to swallow and maintain protective reflexes. Minimal or no nausea, pain, or dizziness. 5. Supervision and documentation. A trained healthcare professional remains with the patient during recovery, documenting progress and any observations. 6. Discharge instructions. Provide clear post-procedure instructions to the patient and caregiver, including avoiding driving or operating machinery for 24 hours. These steps prioritize patient safety and ensure smooth recovery after conscious sedation.
How do you know if the patient fit for discharge after receiving conscious sedation?
To ensure a patient is fit for discharge after conscious sedation, the following criteria are assessed. 1. Stable vital signs. Heart rate, blood pressure, respiratory rate, and oxygen saturation must return to baseline or be within acceptable limits. 2. Alertness and orientation. The patient should be awake, oriented, and able to respond appropriately to verbal commands. 3. Independent airway maintenance. The patient must maintain an open airway and demonstrate normal breathing without assistance. 4. Protective reflexes. Essential reflexes, such as coughing and swallowing, should be intact to ensure safety. 5. Minimal side effects. The patient should have minimal or no nausea, vomiting, dizziness, or pain. 6. Ability to ambulate. If applicable, the patient should be able to move or walk safely with assistance, if necessary. 7. Escort available. The patient must have a responsible adult to escort them home, as driving or operating machinery is prohibited for 24 hours. By meeting these discharge criteria, healthcare providers ensure that the patient can safely leave the facility and recover at home.
Tell me who can discharge the patient from monitoring after conscious sedation?
Only a qualified healthcare professional can discharge a patient from monitoring after conscious sedation. This typically includes 1. Physician or anesthesiologist. A licensed doctor, usually the one who administered the sedation or is part of the care team, assesses the patient and authorizes discharge. 2. Trained nurse. In some institutions, a registered nurse, RN, with specific training in post-sedation care can discharge the patient under the supervision or approval of the physician. 3. Criteria-based discharge. Discharge must be based on established institutional protocols, ensuring the patient meets all recovery criteria, e.g., stable vitals, alertness, and protective reflexes. This ensures patient safety and compliance with institutional and regulatory standards.
Tell me, when do you know when the ambulatory patient is ready to be discharged after conscious sedation?
An ambulatory patient is considered ready for discharge after conscious sedation when the following criteria are met. 1. Stable vital signs. Heart rate, blood pressure, respiratory rate, and oxygen saturation have returned to baseline or are within safe limits. 2. Full alertness and orientation. The patient is awake, alert, and able to respond appropriately to questions and commands. 3. Independent ambulation. The patient can stand and walk safely without assistance, or with minimal help, depending on their baseline condition. 4. Protective reflexes. Essential reflexes, such as swallowing and coughing, are intact. 5. Minimal side effects. The patient reports minimal or no nausea, dizziness, or pain, and symptoms are well controlled. 6. Oral intake. If required, the patient can tolerate small amounts of liquids without difficulty. 7. Escort available. A responsible adult is present to accompany the patient home, as they should not drive or operate machinery for 24 hours. These criteria ensure the patient's safety for discharge and recovery at home.
How do you know that patient fits for discharge from PACU?
A patient is considered fit for discharge from the Post-Anesthesia Care Unit, PACU, when they meet the following criteria. 1. Stable vital signs. Heart rate, blood pressure, respiratory rate, and oxygen saturation are at or near preoperative baseline levels. 2. Awake and alert. The patient is fully awake or at their baseline level of consciousness and can respond appropriately to stimuli. 3. Adequate pain control. Pain is well managed with minimal or no need for additional medication. 4. Effective airway and breathing. The patient maintains an open airway, with normal breathing and no signs of respiratory distress. 5. Nausea and vomiting controlled. The patient has minimal or no nausea and vomiting and can tolerate oral fluids if required. 6. Movement and reflexes. Protective reflexes, such as coughing and swallowing, are intact, and motor functions are restored if applicable. 7. Surgical site assessment. No excessive bleeding or complications from the surgical site are present. 8. Meets scoring criteria. The patient scores adequately on a discharge readiness scale, such as the ALT-READY score, commonly greater than or equal to 8/10. These criteria ensure the patient is stable and ready to be transferred to a ward, step-down unit, or discharged home, depending on their recovery plan.
Do you have a process on how the post-anesthesia patient monitored outside recovery room?
Yes, there is a process to ensure post-anesthesia patients are safely monitored outside the recovery room, typically in a ward or specialized unit. Here are the key steps. 1. Handoff from PACU. A detailed handoff is conducted between PACU staff and the receiving nurse, including information on the procedure, anesthesia type, medications, and recovery progress. 2. Vital sign monitoring. Regular monitoring of vital signs, heart rate, blood pressure, respiratory rate, oxygen saturation, and temperature, is continued at scheduled intervals as per institutional protocol. 3. Pain and sedation assessment. Ongoing assessment of pain levels using appropriate scales. Monitoring for sedation levels to ensure the patient is awake and alert. 4. Airway and respiratory function. Evaluate for any signs of airway obstruction, respiratory distress, or hypoventilation. 5. Post-surgical site assessment. Check the surgical site for signs of bleeding, swelling, or infection. 6. Medication administration. Administer prescribed pain relief, anti-nausea, and other medications while monitoring for side effects. 7. Activity and mobility. Assess the patient's ability to move or perform basic activities safely, as appropriate for their condition. 8. Monitoring frequency. Monitoring is typically more frequent in the initial hours post-transfer and is gradually reduced as the patient stabilizes. 9. Documentation. All observations and interventions are documented in the patient's medical record. 10. Criteria for escalation. Any signs of deterioration, such as unstable vitals, severe pain, or complications, prompt immediate escalation to the physician or anesthesia team. This ensures the continuity of care and safety of the post-anesthesia patient outside the recovery room,